Hello, my name is Kris, and I'm a nurse practitioner here at University Cancer and Blood Center who specializes in cancer genetics. You're watching this video because your provider thinks that you may benefit from having some genetic testing done. Today, I'm going to give you a brief overview about genetics, testing, what the results can be used for, and the pros and cons of getting this kind of testing done. Let's start by talking about genes. You can think of our genes like recipe cards. These recipes, our genes, contain information in the form of coded DNA that's needed to make proteins that perform certain functions in our cells. We inherit all of this information from our parents, and you get 2 of everything from your parents. This means you have 2 copies of every gene. All of the information we inherited from our parents is present in every cell nucleus in your body. A mutation occurs when the information contained in a gene is damaged somehow. Maybe the DNA is exposed to chemicals or radiation, or maybe the cell just didn't divide right. These are called sporadic mutations and are the most common form of cancers. Or there's a small possibility that this is just what the DNA in the family looks like, meaning that the person was born with this information not quite working correctly. We estimate that about 10% of all the cancers out there are due to this type of mutation. This is called a germline mutation and can put the person at risk for certain conditions. It also means that family members can carry the same mutation, and there's a 50% chance of passing it to your children. All cancers have sporadic mutations. Your provider may send a sample of your cancer out for genetic testing. There are specialized treatments that can be given if cancers have certain mutations. This means you can have personalized treatments done by your doctor. If you have this type of mutations, also known as somatic mutations, this doesn't mean that you were born with them. It also means you probably can't pass them on to your children. My job is to test you, the human, to see if you have any of these germline mutations which could contribute to your cancer developing. Some of them may also lead to targeted treatment options, but it also may lead to the risk for other conditions as well as the risk of passing them to your children. The test is a simple blood test that often can be drawn at the same time as other labs that have been ordered by your provider. These are sent to a specialized lab for analysis, and the results generally take 2 to 3 weeks. Results come in 3 categories: positive, negative, and a variant of uncertain significance. Most of the tests I do come back negative, meaning there's no evidence that your cancer was related to a change built into the germline genes. Remember, only 10% of all the cancers out there are due to germline mutations. If you are positive, that means the lab saw an error in your gene that prevents it from making the proper protein. This could be part of the reason that you developed a cancer and may or may not give your provider personalized treatment options for you. This also means that your provider can use this for your future management by screening for early cancer detection, medications to reduce cancer risks, and even risk-reducing surgeries. If you're found to be positive, your blood relatives may be offered genetic testing to see if they're carriers. Then their providers can also help reduce the risk that they will ever be diagnosed with a life-threatening illness. A variant of uncertain significance, or VUS, means that the lab saw a change to the DNA, but there's not enough evidence to see if it stops the protein or not. All humans have variants, but if we haven't seen that change in enough people to know what it does in real life, we can't use that test result. The lab will continue to try to gather data about the variant to reclassify it. Most VUSs that are reclassified are found to be benign changes and aren't related to cancer development. So these results are considered negative until that time. For most people, knowledge is power. This is information that can be used to guide their future health decisions. For others, the knowledge that they might be at risk for certain diseases might not be a good thing for them. You have to ask yourself, do I want to know? If you're ready to get this kind of information, you can go ahead with the testing. If not, we can talk more about this at your appointment. Then you can decide whether or not you want the testing. One of the concerns about genetic testing are the potential costs. Most insurances will cover this type of testing as long as you meet their criteria, which is based on the type of cancers seen in you and your family. If you haven't yet met your deductible for the year, that may apply and may make the test seem more expensive. However, most labs offer income-based assistance programs and payment plans, and some of them even offer cash prices for those who don't have insurance or if you have a very high deductible. Another concern is privacy. Some people are worried that if they test positive, their health insurance may raise their premiums or drop their coverage. But there's a federal law called the Genetic Information Non-Discrimination Act, or GINA for short, that prevents your insurer from changing your coverage based on your genetic testing results. There is also employment protections in GINA for those who work for a company that has 15 or more employees. Other types of insurances, such as life insurance or disability policies, may not have these same protections. We can give you a handout for more information. I hope this video answered some questions you may have about genetic testing. If you're ready to move forward, just let your provider know and we can arrange for sample collection. If you need more time or information, let's talk soon. Thank you for trusting your care to University Cancer and Blood Center. I look forward to talking with you at your appointment.